we all worry about the direct effect of opiate on the fetus and particularly on the developing brain. We know that there is not any increase in birth defects from our database on the developing fetus. For developmental outcomes, opiates themselves, I think we feel reasonably comfortable that don't have an adverse outcome on neurodevelopmental outcome. However, because a mom who is on opiates or addicted to it or using beforehand may also be using other medications or drugs, alcohol, smoking, those probably have more concerning effects on developmental outcomes. So since they are tagging along, if you will, with the opiate abuse, it's very difficult to isolate the opiate effect on neurodevelopmental outcome. But from what our work has shows us so far, if you can isolate that effect, it does not seem to have an adverse neurodevelopmental outcome. For the short term, the baby who's been exposed to opiates during the pregnancy, and we keep, in our information that we keep track of, we have babies exposed to prescribed methadone, prescribed Subutex, prescribed narcotics for pain, and then we have a category illicit, those that weren't in any recovery. Interestingly, the latter category represents just under 10% of all the babies that we see. Methadone and Subutex are about 50%, or each, or 50-50, I should say, of the babies that we have, and represent close to 70%, and then about 20% are narcotics for pain. There is a opiate withdrawal syndrome. About 60% of babies exposed to methadone in the short term will have withdrawal significant enough where we need to do treatment. Subutex, and probably about 40% of those babies will have withdrawal significant enough to treat, and with the prescribed opiates, probably about 35%. Okay. So in the short term, what we deal with is trying to detoxify the baby from having been exposed to an opiate throughout the pregnancy.